2011, I was diagnosed with cancer, which meant that I had to have major surgery. I definitely wanted to be out of hospital as soon as I could for the surgery to be successful, to recover and to just be able to get on with my life as soon as I was able to. Enhanced recovery means preparing properly to go in for major surgery and knowing what to expect and recovering more quickly than you would otherwise have done.
There is good evidence that Enhanced Recovery Program helps us to improve your recovery, and it also helps us in reducing the complications like chest infection, wound infection, blood clots, and any other reason which delay your discharge from the hospital. There are three main aims of the program in order to achieve your early discharge from the hospital: is get you better control of pain, get you up and about, and making sure that you're eating and drinking well so that you can be safely discharged.
Pre-surgery, I had about a month between being told I was going to have the surgery and actually having the operation, and I just got myself into the best shape that I possibly could. Deep breathing exercises, and just mentally preparing and knowing that there were certain things that I had to do, and to follow the advice was going to be the best way.
Pre-assessment is taking a medical history of a patient to ensure that they're fit to have an anaesthetic. Before coming to pre-assessment, patients should remember if they have any medication to bring that with them, and also the regime that they have them, so that when they actually come into hospital they're given their correct medication.
I mean, I'm having quite a lot of difficulty getting up and down the stairs already at the moment, so I'm worried that that's
also, if they need any care after, to inform the pre-assessment nurse so they can have that in place for when they're discharged home.
Okay, good afternoon everybody. My name is Siobhan. I'm part of the Enhanced Recovery team here at the Whittington.
Well, the pre-operative education session I found absolutely invaluable because it was a time when we were invited to meet members of the team.
So I'll be talking to you about what happens while you're in hospital and about discharge planning. The pain team will talk to you about the anaesthetic and pain management post-operatively.
The education session was extremely beneficial for me. Going to that and listening to the advice that was given and then following it very carefully afterwards, I felt was something that I could participate in that was really helpful.
Hi Priya, it's Lydia here. I just wanted to remind you, you know I'm going in for surgery and you said that you'd be able to pick me up when I come out.
It's important that you let any relevant family and friends know that you're coming into hospital and when you're likely to be discharged. So before you come into hospital, there's a few things that we'd like you to do. Firstly, we want to ensure that your home environment is safe for your return. So if there's any clutter, if you could arrange for that to be removed, either by yourself or some family and friends. It's unlikely you'll be able to do your weekly food shop when you return home from hospital. Therefore, stock your food cupboards with some non-perishable food items, and also it might be a good idea to have some frozen meals in your freezer. Lastly, if you could prepare your night bag, please only pack the essentials and your team will advise you what to bring with you.
Very important that you follow the guidelines given to you by the consulting team when to stop eating and drinking. Though we do need to make sure that you are hydrated throughout the process. So depending on the time of your operation, you could well be offered a drink of water.
I felt very anxious indeed going into the anaesthetic room. I was apprehensive, but I knew what to expect, and I had a great deal of reassurance from the team, who were excellent, and in the end it wasn't as bad an experience as I thought it was going to be.
So you can either have a general anaesthetic or a regional anaesthetic. By regional I mean either a spinal or an epidural, and sometimes they can be combined with a general anaesthetic. The right choice depends on you and the kind of operation that you're having. So the anaesthetist will make that decision with you before the operation. So when the patient first arrives in the anaesthetic room, they are asked a checklist of safety questions, which you may have been asked many times before, but it's important that we don't miss any important information. After that, some routine monitoring will be attached and a small needle will be placed in the back of your hand. If you're having a regional anaesthetic, such as a spinal or epidural injection, it's likely that will be done at that point. After that, you'll be given some anaesthetic medicine, usually in the drip in the back of your hand, and some oxygen to breathe just before you fall asleep.
Retrospectively, I believe that having the epidural was extremely beneficial because I experienced less pain post-surgery than I had been led to believe I would probably experience, and of course that's always fantastic. It's very positive.
So my role when treating patients who are in the Enhanced Recovery Programme is to really perform the surgery in a way that promotes their early rehabilitation, and that really involves minimising the stress and trauma which they go through at the time of surgery. So that involves performing surgery in a relatively timely fashion and using surgical approaches that are relatively minimal and reduce the trauma to the surrounding tissues. This helps promote early restoration of function and minimises the blood loss at the time of surgery. In particular, what I take a lot of care to do together with my anaesthetist is use various techniques to minimise the pain the patient feels in the early period following surgery.
Hello Frankie.
Hello, how are you?
I'm very well, thank you. This is our lovely patient Lydia Harris.
Hello Lydia. My name's Frank. I'm the recovery room nurse. I'm going to be looking after you. Your operation's finished and you're in the recovery room here with me. I'm just going to...
After the operation, you'll be taken to the recovery room where it's likely you'll still be quite drowsy. It may take some time to wake up. During that period, you will be monitored quite closely, and so as you wake up, you'll notice that you may be attached to some drips and to some monitoring machines.
I don't remember very much about immediately afterwards, as I was very groggy, but I do remember being offered a drink of water, and I was very grateful for that because I was quite thirsty.
So when you're feeling sufficiently awake and the recovery nurses are happy with all of your observations, then you'll move to the ward or an area of closer monitoring depending on your needs as discussed and agreed before the operation.
We focus a lot on managing your patient pain well, getting you up and moving soon after surgery, and getting you eating and drinking as well, and building up that diet.
It's absolutely fine for you to eat and drink and walk around whilst you have some pain. You will have some degree of pain, and that's to be expected. That's why we give you regular painkillers. However, if you need some more, please let nurses know and you can have some additional painkillers.
I followed the advice of the team, but it was also made very clear to me, and I appreciated the fact that if I needed more pain relief, I could ask for it, and I knew what I was able to ask for and what was going to be available. I was actually quite hungry. I ate small amounts regularly. I drank a lot of water, and I just kept it, you know, if I was feeling slightly queasy, I would perhaps just try and have a piece of toast or something small, but I knew that it was important to try and just keep your body as regular as you possibly could, and so just try and keep it normal.
Okay, so if you try and shuffle your bottom towards the edge, all right, to try and get your feet to the floor, that's it, one side at a time. Brilliant, well done, okay. Feel okay?
I knew that post the surgery there were certain milestones that I had to reach, and that if I followed the guidance that had been given to me, that I would recover very, very quickly, which in fact was my experience. I was out of hospital very, very soon after my surgery. I knew that there were going to be certain things that I was going to have to do physically after having had the surgery. I was going to have to get out of bed the day after my surgery, and although I didn't really especially feel like it, and it seemed to be a very, very slow movement from bed to chair, it was one of the milestones that I set out to do, and I was determined, no matter how slowly I did it, that I was going to do it. Everything that I managed to do felt like such a huge achievement. I pushed myself a lot to do all of these things, you know, to use the bathroom on my own, to go up and down stairs, to walk around the ward. I remember getting to know every bed and every window extremely well, but I pushed myself, and I was really, really pleased that I did. It was important for me to leave quickly because I didn't want to catch any infections, I didn't want to get clots in my legs, I didn't want to lie around. I wanted to be back at home doing the things that I normally do and returning to life.
Recovery time varies between patient to patient. It depends upon the type of operation and also depends upon their general health. We come and review our patients every day. We ensure that they are recovering well, and we discuss their progress with the patient. We also ensure that all steps are taken to avoid any delay in the discharge. But you will only be discharged once all the medical teams are happy with your recovery and it is safe for you to return home.
I really felt safe going home. I knew that the team wouldn't send me home unless they felt that I was ready, and I knew that they had assessed that I was in the right physical condition to go home. I feel that they knew that I would be able to look after myself and that I had the right plans in place. People at home to look after me, I'd prepared well, I had somebody around, I had food, and everything was in place really for me to be at home rather than be in hospital. For me, it felt extremely important to meet and to know the team that was going to treat me. I felt very confident with all of them when I met them. I knew that they were all very approachable. And obviously when you're in hospital, you feel very vulnerable. It's very, very nice to have people around you that you've already spent time with, who make you feel confident, who invite interaction, questions, and who also make you laugh. 3 years on, I feel absolutely great. I'm healthy, my life's back to normal. I couldn't be happier with the treatment that I received, and my heartfelt thanks go out to everyone that was involved in my treatment and my recovery. It couldn't have been better.